Ladies and gentlemen, this is your video on arteries and veins and the different tissue layers. So first we have to tell the difference between arteries and veins, right? So arteries have thicker, bigger muscles. So this model you have three vessels here, right? Middle vessel here has big, thick muscles, whereas the two side ones have tiny, thin muscles. And the side one here has valves in it. Only veins have valves. So between the tiny muscles and the valves, the two sides here, open valve, closed valve, the two sides here are veins, tiny muscles, veins. And this middle one is a big artery, right? So now we know the difference between arteries and veins. We have to know the different layers. There are three major basic layers that we can think of. You have the inside layer, the muscle and middle layer, and then the outside layer, right? Your fancy terms for those, for layer, is called a tunica. So you have a tunica externa, which is the external or outside layer. Depending upon how fancy you want to be, that is also called a tunica adventitia. Either one is acceptable on y'all's midterm. Tunica media is the middle layer with the muscle, right? And then the innermost layer, which is the most intimate layer with your blood, is called your tunica intima. It's a tunica intima. We can continue to divide these by sublayers. Lumen is the smooth inner layer here that blood actually touches. So the lumen is where blood actually touches in both your arteries and your veins. And your tunica intima has this inside endothelium, a covering over that endothelium called the subendothelial layer, which is what these gray parts are here. And then to compensate for stretch, for give and take for your blood flow, you have a little elastic layer, which is what this elastic white layer is here, called the internal elastic lamina. You have all three of these layers for both arteries and veins, right? Your tunica media is more complicated for arteries than it is for veins, because the tunica media is this muscle layer, which is bigger for arteries, but arteries have a second elastic layer here, right? That second elastic layer in the arteries is called the external elastic lamina. So the tunica media has both the muscle layer and the external elastic lamina for arteries, but just a muscle layer for veins. And then you have this outer layer called the tunica externa or tunica adventitia. I know this is going to sound weird, but your blood vessels also need to be fed blood so that they can continue doing their job. So there are itty-bitty little arteries and veins that cover your big blood vessels as well, so that your big blood vessels can also have blood flow and eat. So, yeah. Collectively, that's what these dots here are. They are cut arteries and cut veins in your tunica adventitia or tunica externa. All of those itty-bitty blood vessels are collectively called the Vasavasorum. So these little dots that cover everything on the tunica externa are the Vasavasorum, that are the tiny blood vessels that feed the tunica externa. They can also be called the vasa lamina, depending upon your textbook, but your lab list calls them the Vasavasorum. Once again, I'm fine with either of those terms that you learned. But there you have it. That's your model for the difference between arteries and veins, and your like the parts on y'all's lab list. Let me know if you need any help.